If your dog cuts his leg, bandaging the wound can reduce bleeding, keep the wound clean, and provide protective padding until you can get to a veterinarian. Some dogs will not allow you to touch their feet or legs without sedation. If you think your dog might bite, don't try to apply a bandage. Just transport the dog to a vet as quickly as you can. Before an accident occurs, make sure your canine first aid kit contains all of the supplies you need to apply a bandage. If you don't have first aid supplies at hand, you can use common household supplies. To bandage a wound on your dog's leg, you will need the following items: electric or battery operated clippers, bandage scissors or household scissors, surgical lubricant or Vaseline, gauze sponges or clean paper towels, telfa pads or trimmed band-aids, cast padding or strips of paper towels, clean gauze or clean hosiery, vet wrap or duct tape, elasticon or white medical tape, flushing syringe, turkey baster, or sink sprayer hose. Try to find someone to restrain your dog so he can't interrupt the bandaging process. Before applying the bandage, you must clip the hair around the wound. First, cover the wound with a dab of clean surgical lubricant or Vaseline to protect it from the hair clippings. If you have a long-haired dog and no clippers, use scissors to trim the hair around the area. Wounds near the foot pads are difficult to clip around. Use scissors for these types of injuries. Clean the wound as thoroughly as possible before applying the bandage. Using a syringe or turkey baster, flush the area with clean water. You can also use gauze and an antiseptic solution such as chlorhexidine. Gently dry the area with gauze sponges or clean paper towels. Do not apply alcohol or hydrogen peroxide to your dog's cuts. This will only cause irritation and does not provide additional benefits. Place a telfa pad or trimmed band-aid over the wound and wrap cast padding or strips of paper towels around the leg. Start at the far end of the leg and work your way up, then work your way back down. Apply the padding in an overlapping pattern until at least 2 layers cover the wound. Cover the cast padding with a single layer of overlapping clean gauze or pantyhose, starting at the end of the leg and moving upward. The bandage should extend several inches above and below the wound. Cover the bandage with 2 layers of overlapping vet wrap elastic gauze, wrapping it fairly tightly. This is the protective layer of the bandage. You can substitute duct tape if you don't have vet wrap, but do not apply it tightly or you risk cutting off your dog's blood circulation. To keep the bandage from sliding down, wrap elasticon or white medical tape around the top and the bottom. To avoid cutting off circulation, do not apply the tape tightly. Just lay it in place and gently press down to adhere it to the bandage. Now, your dog has a protective bandage. You should still visit your vet. Your dog might need antibiotics and pain medication. If the wound requires stitches, this should be done within 24 hours of the injury. After suturing the wound, your vet will apply a more permanent bandage that will last for 3 to 4 days. Remember, your home-applied bandage must be removed and reapplied every 24 hours.